Hi, I'm Dr. Roberto Scaffidi of Bay Health Medical Group Cardiology Consultants, and today we're going to talk a little bit about physical activity guidelines. So the first component involves aerobic activity. The second is weight or resistance training. The third is flexibility training, and then the fourth would be balance training. All four of these elements are pretty important, but as you'll see when we talk about older patients or patients with coronary artery disease or prior stroke, the last two of those elements become a little bit more important. So first off, why do we want to exercise? Why do we recommend an exercise program? Well, the first and most important benefit is the mortality benefit. Studies have shown that in patients who do regular, moderate, or vigorous physical exercise that you can have up to a 40% reduction in overall mortality with regular exercise. In addition, there's benefits in terms of cardiovascular mortality. There's a reduced risk of development of high blood pressure, high cholesterol, and diabetes. There's a reduced risk of development of certain types of cancers. So there's some studies that have suggested an improvement in cognition and a reduction in the development of dementia in elderly patients. You have an overall improvement in quality of life. There's a decreased incidence of anxiety and depression type symptoms. And there's also benefits, of course, in terms of overall vascular health, bone density, and weight loss. So to start off with our physical activity guidelines in all comers, the current recommendations are anywhere from 150 to 300 minutes of aerobic exercise per week. That's generally 30 to 60 minutes of aerobic exercise 5 times weekly. Now, what types of exercise are included? Well, basically all types of exercise can be included in what we're talking about. The most common and probably the easiest thing to do is simply walking. It doesn't have to be jogging, it doesn't have to be power walking, just walking at a moderate pace for 30 minutes 5 times a week can reduce your overall mortality and provide you with the benefits that I mentioned before. So it doesn't, the 30 to 60 minutes of exercise 5 times a week does not have to be all at once. As a matter of fact, there's been studies that show that people who can only do the exercise in 10 to 15 minute increments but do the 30 to 60 minutes total per day derive the same benefits as someone who does 30 minutes of continuous exercise 5 times a week. On the other side of things, if you do more vigorous activities such as aerobics or running or competitive biking or sports, vigorous activity actually gives you the same benefit in half the time. So instead of, for instance, walking for 30 minutes 5 times a week, if you jog for 25 minutes 3 times a week, you're getting a similar health benefit. The main and most important thing is that anything is better than nothing. If you don't have the time to do that much exercise, either because of work commitments or commitments with your family, doing even a little bit will help to improve your overall health and give you some reduction in the risks of major heart disease, diabetes, and the other things that I mentioned earlier. So in addition to aerobic activity, resistance training is also very important. The current guidelines recommend 2 days of resistance training per week for at least 10 minutes at a time. Resistance training can include lifting weights, doesn't have to include lifting weights. Even body weight exercises such as push-ups or squats or lunges all count. That helps to build bone density, helps people to maintain their balance, and allows for healthier aging as well. So let's move on to patients who have a history of cardiovascular disease or stroke. In general, those patients can still do most of, if not all, the same types of exercise that an otherwise healthy individual can do. However, depending upon how you're affected by your cardiovascular disease or prior stroke and what sort of limitations you have, the programs might have to be a little bit more individualized. Specifically in someone with cardiovascular disease, consultation with your cardiologist is always a good idea to make sure that you're capable of starting an exercise program. In many cases after a heart attack, you may have undergone cardiac rehabilitation and are already in some sort of a structured exercise situation, and if you're doing well in maintaining those levels, you could continue to exercise without any significant difficulty. In some cases, if you haven't exercised in a long time, you might need to see your cardiologist to get clearance, and in some cases might even need a stress test prior to proceeding with an exercise program. As I said, those programs should be a bit more individualized, taking into account your own personal limitations. For instance, in patients with a history of congestive heart failure, they may not be able to exercise for the duration of time necessary to get the exercise benefits, or at least not all at once. In those cases, exercising for shorter periods of time but getting a total exercise time of 30 to 60 minutes per day may be easier or more beneficial. Also, the type of exercise that they may be able to perform may be different. Someone with heart failure might not be able to do regular running or sports or other more vigorous physical activities. So walking, whether it's with an assisted device or not, might be easier for them to do. Similarly, in patients who have had a prior history of stroke, who may have weakness on one side or the other, using an assisted device to help them walk and get their exercise may be a little bit easier. Alternatively, other strategies such as walking on a treadmill or using a stationary bike or even floor pedals might be a better way of getting the amount of exercise that they need for maintaining their physical health. Once again, the most important thing to do is to be as active as conditions allow. Another important thing, especially amongst my cardiac patients, that I tell them is if you develop chest discomfort or any symptoms similar to a prior heart attack when you're starting an exercise program, stop exercising immediately and don't do any more exercise until you get in contact with your cardiologist. So I've had questions from my patients in regard to what to do with exercise in the time of COVID. Obviously, patients who have a history of cardiovascular disease or stroke are at a higher risk of contracting COVID infection and having more serious COVID infections. So avoiding situations where they would be more likely to contract COVID are very important. Wearing masks and social distancing are just as important in exercise as it is in any other situation. Generally, I would advise exercising or walking outside if possible. Most likely you'll have less contact with other individuals when walking outside. I would recommend to my patients that they generally try to avoid going to a gym. If they go to the gym, to go early in order to avoid crowds so that they have as little additional exposure to COVID as possible. So moving on to the elderly. Once again, exercise and strength training is very important, but in this case, stretching and balance training can be equally important. As we get older, we may develop more limitations from osteoarthritis or other problems that affect our ability to maintain our balance and to exercise to the level that we may want to achieve. We're also more prone to injuries as we get older, so stretching is extremely important. In general, stretching is recommended after exercise so that the muscles are warm and pliable. Stretching can involve upper body stretches or calf stretches or even quadricep stretches. Also, activities such as Tai Chi and yoga are helpful for maintaining flexibility. The important thing with stretching is to make sure that you're not overstretching the muscle. You want to feel some tension in the muscle when you're stretching, but you don't want to stretch to the point of pain. Regular stretching will make muscles more pliable and exercise easier over time. Another important issue in the elderly is balance. A lot of times elderly patients have trouble maintaining their balance and therefore being able to perform exercise on a regular basis. This is where balance training comes in. It may be beneficial for your cardiologist or your primary care doctor to refer you to a physical therapist to go through balance training to allow you to be able to exercise safely without the worry of falling. Once again, any type of exercise is beneficial to you. If you have to exercise using a cane or using a walker, there's no problem with that. You're still getting the same amount of exercise and activity that you will without those assisted devices. Additionally, using other means of exercise, such as a treadmill or a stationary bike or floor pedals, can help you get the amount of physical activity you need without having to worry about maintaining your balance at the same time. So in conclusion, regular exercise is beneficial from everyone young to old. There's proven mortality benefits with exercise, and it will help with healthy aging.